Vrikshasana is a combination of two Sanskrit words, vriksha, meaning tree, and asana, meaning posture. Why it is called so? It is called the tree pose because your body mimics a tree by rooting your foot into the ground like a base while your arms reach up like branches, teaching you to stay steady and calm as you balance. Steps to perform Vrikshasana. Stand straight, feet together, hands by the side of the body. Let's add breathing to each step to practice it mindfully. Inhale, place the right foot on the left inner thigh by bending the right knee. Shift the body weight onto the left leg, keeping it straight. Exhale, join the palms together in front of the chest in Namaste. Fix your gaze on a stable point in front of you to maintain balance. Inhale, raise the hands above the head. Keep your spine straight. Hold the asana for up to 30 seconds. Keep your breathing normal. Then, with an exhale, release your hands gently back to the sides of the body. Inhale, place the right foot back on the floor and relax. Then, repeat the whole steps with the other leg. Tips to practice Vrikshasana correctly. Fix your eyes on one unmoving point on the wall in front of you. If your eyes stay still, your body will too. Avoid placing the foot on knee joint because sideways pressure can hurt the ligaments in a joint meant only to bend forward and back. Instead, place the foot either below the knee or above the knee, according to your body's flexibility. Engage your core. Gently tighten your stomach muscles and keep your spine tall, as if a string is pulling the top of your head upward. Benefits of Vrikshasana. Improves posture. Calms the mind and reduces stress. Improves one-leg balance and coordination. Strengthens ankle and knee joints deeply. Activates hip muscles, opens the hips. Builds better body awareness on one side. Improves neuromuscular control, mind-body balance. Enhances concentration by focusing on a fixed point. Who should avoid or be careful while practicing Vrikshasana? People with knee injuries, people with ankle or foot pain, those with recent hip injuries, people who feel frequent dizziness or vertigo, anyone with balance issues should practice with wall support. Keep practicing. Thank you for watching.